All right, and a pleasant and welcome back to Caribbean Rhythms Radio Network. It's 5 minutes after 6 o'clock on this beautiful Saturday, and we're about to get into another session of Caribbean Diaspora Live for this evening.
Yes, welcome everyone. Thank you for joining us again at Caribbean Diaspora Vibes, and we've got an awesome show for you today, a very important topic. This show is about prostate cancer awareness, prostate health, critical show. So I hope you guys take notes, and this is being recorded live on Facebook. So you'll be able to go back, over and over to it. We do want to welcome our education contributor again, Dr. Christopher Scott, Heritage Jamaica. Diaspora is locally here in Central Florida. We want to big him up, and it takes a lot for individuals to carve out time out of their busy schedules to come on and share this information with you. So we do hope that you write notes or go back to it for if it's not for yourself, for your loved ones. So with that, blessings. Welcome, Dr. Scott. We see you in the scrubs. You're at work.
I came from work, but this is important, so I wanted to make sure we set aside the time to have these discussions.
Well, you're playing the role today, my brother. You fit the role.
So if they had any question on the credentials, at least they know I dress up.
Yes, sir. You come straight up. Good evening, everybody, and welcome to another edition of the Caribbean Diaspora Vibes Live. Donna, how are you? I know you are somewhere.
Yes, I'm actually at another women's retreat on the beach over here in Clearwater. So
nice. Good.
Just vibing really, really well. I even, I didn't even go out on the boat. They went dolphin, viewing, and I said, no, I have to wait for Dr. Scott. He took his time
out, yes,
and I must pay respect. So
absolutely good.
But I will be having the margaritas after. Soon as we finish the show, Louis. Soon as we're done.
I'll be right there with you with a bourbon. So
there you go. All
right.
Yeah, Doctor, welcome. It's a pleasure having you as a male on this side of the town here. It's always a pleasure. And it's always interesting for me to talk about, prostate cancer and all that stuff. I have one of my uncle passed away several years ago with this disease or, issue. And so, one of the things I hear people talk about is that it runs in the family and, all these things, which I know I will get into, but I'm always interested to find out more about this subject. I think men and on a whole, we don't do much to find out about ourselves, to help ourselves, until maybe we start having some erectile problems. That's when we get freaky and say what's going on, but there's so much to learn from it. So I want to welcome you this evening. It's really a pleasure having you on our broadcast this evening. And so if you could take the time to just tell the people a little bit about yourself, your background, and what type of, what do you specialize in?
Absolutely. So, coming out of Jamaica from Ensom, Spanish Town, we had that conversation before. As a youth, grew up in New York City, trained at Howard University Medicine, Emory University in Atlanta, and have now been here in Central Florida for 15 years. I practice emergency medicine and trauma. I'm actually the head of a group that staffs several of the emergency departments, both in Central Florida and up and down the west coast of Florida for the HCA facilities. It's one of the largest contributors of medicine in the country, actually in the world. So that's a little bit about me and my title. What's really dear-hearted about this topic, people of color, people from the African diaspora, especially over in West Africa, which inundates the Caribbean. So those in the Caribbean and in North America have the highest incident of prostate cancer. So that means both you, I, your grandfather, your uncle, your children, your pooper, not your mama, but anybody else that would fall into
Everybody.
that category. So anybody that you look to the left or the right looks like you will be affected by this at a much higher rate than those without color. So that being said, the significance of the screening, of definitely seeking care and at least knowing about it, is that cancers are rated by their 5-year survival rate. There's 3 levels to this cancer. If it's localized, meaning really just contained within the prostate, and let's talk about what the prostate is.
Yes.
The prostate is a golf ball sized gland that sits right underneath your bladder. And you know, your urinary bladder is what holds your urine.
Mm-hmm.
And the urethra, which is a tube by which urine and semen during ejaculation. We have to have real talk. We're going to use medical terms.
Absolutely.
You know it as when you come, but we'll use the medical terms when your ejaculation and your urine both travel through the same tube when they enter when they exit the penis.
Right.
So the prostate wraps around that tube and passes through. Now, the significance of this is when the prostate swells, it squeezes down on the tube.
Mm-hmm.
So we'll talk about that shortly. But the main thing is that if you find this disease and it's contained within the prostate locally, you have a 99% chance of living the same 5-year lifespan as someone who does not have it. If you find it and it's just around the prostate regionally, you have the same 99% chance of living, a life equivalent to someone who does not have prostate cancer. The problem is, once it has spread distally, metastasized, moved to other areas of the body, the spine, the back, the lungs, your chances of surviving 5 years decrease dramatically to about 32%. Now, that's a 3-fold increase in the death rate. And it's a very slow growing cancer. So the problem is this: for people of color, people like us, by the time we're 50, we're actually at high risk of developing this. And if we prolong, by the time we reach 60, you're talking about a 30% chance of dying by the time you're 65. Whereas if you can catch this and be aware by 50, you'll 99% chance you'll make it to 55. You stay on top of it. You see, you can extend your lifespan. So it's as simple as having some screening tests. The most common, of course, is the PSA, or the prostatic antigen. It's a blood test. It has some very specific criteria. And this is recommended to be broken down for men of color between 40 and 45 years of age, and I'll tell you the difference. For most other individuals, non-colored, especially Asians who have the lowest risk, they can start their screenings at 50 years of age. For people of color, it is highly suggested you start at 45. And if you have a relative, such as yourself, a brother, I'll even extend it to an uncle, a father, who has developed prostate cancer before the age of 65, it is highly suggested you start your screening at 40. Now, the problem with, the connotations or the ideas that go around screening, and anytime you talk to males about the penis, and if they start thinking about erectile dysfunction, and culturally, that's what make us the men we are.
Yes, sir.
That leads to a lot of hesitancy. So they don't even want to broach the topic. They don't want to go into the doctors and have these conversations. And, there's the whole stigma of having the digital rectal exam. But you can imagine someone who could be caught at 43 and seek treatment and definitely make it to 47. If by the time 47 comes and the thing is already gone distally, as we discussed, their chances of making it to 50 have decreased significantly. So definitely want to let our people know that this is something that affects us directly, irrespective of weight, irrespective of sexual gender, irrespective of height, beauty, charisma. None of that matters when it comes on to this. You need to make sure you get yourself checked. I'll pause there to see if there's any questions on anything that I just spoke about.
Well, what are some of the, what I would love to know are some of the early symptoms that
Absolutely
we men should know about and sort of watch those things. And I'm going to say men, but I also want to, doctor, very, very important. I think our women should play a very important part in noticing these things too, because they are the closest to us. They see us day and night in all different conditions and situations. And so I'm going to also say what both us men and women should see in terms of the symptoms of this.
So I would,
yes,
that
ma'am.
Possibly we can't identify.
Well, I'm going to tell you some symptoms that you definitely can identify. I'm going to tell you the number one symptom for a woman and a man to look for.
Okay.
If you notice your man waking up frequently in the night, go and use the restroom. Something is wrong. Now, prostate can be one of them. It can be several other things. It can be diabetes. It can be just an enlarged prostate. But if you're waking up, I would go as far as to say more than once during the normal course of a 8 to 9 hour night span, something is wrong. You need to at least have it investigated. So you will know if you're sleeping next to somebody, if they're waking up all the time and going to the bathroom. The next thing for the male in particular, if when you're going to the restroom, you find you have to go really bad, you have a sense of urgency and just a little bit of wee-wee comes out, then that is a problem. You will know what your normal stream, force, and kind of the amount that you used to stand over the commode and discharge used to be. And now you find in 2/2s, you just get a little dribble. Something is wrong. So decreased pressure in stream with increased frequency of going. Also, what you'll see is you might see some blood in your urine or your ejaculate. That is a problem. That is not normal. And also if it's associated with pain.
That's extreme right there.
That's extreme. So you know, hey, that's not normal. And you know, depending on your female counterpart, if it's something they see, just know that that is not normal. You need to have it checked out. So those would be your top indicators. Now there are some other things, again, really on the extreme. If all of a sudden you are having erectile dysfunction, because the nerves that help innervate pass around that gland. So if they start getting affected by other things, you might have some trouble, you know, keeping the soldier at attention. So again, something that you may want to look into. And that's the significance of the anatomy where I showed you that the tube passes through that gland. When it gets swollen, hard, or changes in any way, it squeezes that tube and urine is not, and semen is not able to pass through as effectively as it used to.
Interesting. And okay, so someone who is listening have all in a sudden, as you said, I am going to pick up from there. All in a sudden, he was active. It's an active male. His soldier is standing at attention all the time, but something drastic that happened. All in a sudden, you can that fail you.
Right.
Okay. What is the first thing, or what is your recommendation, or what is the what needs to be done at that point? Then, when you experience that, instead of running to go get some Guinness stout and some drink or mix up a juice and make it worse, because we tend to want to do that.
Of course.
We tend to want to go mix up some juice or get some pill or whatever because things now work right.
Now work proper. First thing out your mouth, yo, my woman now turn me on like.
Right.
Or whoever turn you on. That can be the first response. We have to start looking in the mirror and say, wait, something is wrong. I need to make sure this is not something more serious.
Yes. Okay.
So before you grab your roots, your peanut punch, your sarsaparilla, your brush with, the list goes on and on of what we can use. Check a physician and make sure it's nothing medical. Because while yes, sometimes emotions and mental can go into it, right? You're not in the mood and certain things, stress. You need to make sure it's nothing that can be life-threatening down the road.
Is there any particular remedy at this time? Say, well, okay, you go to the doctor and the doctor don't give you a sense of, man, you know, go ahead and do this. The most of the doctor will do is give you some tablets. Some of the doctor will give you tablets to say, well, try this. Are there any natural things that someone can do, like exercise, or because you mentioned muscle around the, you know, I don't know the term, but I know you mentioned muscle. Muscle are things that sometimes can be strengthened.
All right.
Are there exercise to be done that a man can do naturally within himself to bring back some of those muscles to help? So
you're specifically talking about erectile dysfunction, right?
Well, yes, let's talk about, yes.
All right. So erectile dysfunction, irrespective of the prostate, right? Because if it's the prostate, we need to go down a certain path. But let's talk about other things that cause erectile dysfunction. The first thing to really understand is that the mechanism of an erection within the penis is directly correlated to blood flow and pressure. The penis actually fills with blood when the nerves stimulate it in that manner. And it is that pressure that keeps the penis erect. So the first and actually more common cause of dysfunction are problems with our blood pressure. So if you're suffering from high blood pressure that's causing what we call shunting, so let's say blood is going to other places. And this is why sometimes men, especially our men of color, tend to not be compliant with our blood pressure medicine. Because if we're lowering our blood pressure, sometimes certain medications can affect the pressure within the penis. Then you have certain things that will affect the nerves that stimulate the penis to fill and engorge with the blood. Yes. The most common thing for us, again, that affects our nerves is diabetes. So if your sugar is out of control, it's frequently running high, that sugar attaches to the nerves within the penis structure and around the pelvis. And it makes it harder and harder for those nerves to stimulate the vessels to pump the blood pressure. And then, of course, you go down the line, stress releases cortisol. It's not going to put you in the mental mood to stimulate the nerve, to enervate the blood pressure. You see how the cycle is that I'm breaking it down. Yeah. So you'd have to check your stress levels and your well-being. Certain herbs, if you're familiar with saw palmetto, very good for keeping the prostate small, shrinking it, allowing good blood flow, allowing good release of urine from the bladder. So that would be a good natural herb to maybe incorporate in the diet. But you also have to do the other things. Watch your salt intake, proper exercise, watch your carbohydrates. If you find out you are diabetic, make sure you're compliant with your regimen, because the sugars affect the nerves, the pressure affects the penis engorgement, and again, then you have the prostate on the back end. So hopefully that gives you a kind of an insight into just the mechanism of the erection, because if you understand the mechanism, then you can address it at the different levels.
Got to. So many things run through your mind. You know, what is one, if you should say one particular thing that a man should do to prevent prostate cancer, what would you recommend?
So preventing is difficult because it's really associated with genetics, it's associated with race. It's not like lung cancer where you can say, listen, smoking has a direct influence on lung cancer. It's not like colon cancer, where you can say too many nitrates, smoke-infused food has an influence on colon cancer. So if one of the number one risk factors is being Black, I cannot tell you to change that, right? so that already puts you in a certain state. And then being Black from the Caribbean or from North America again. So one of the things I would really say to look out for is your diet. There are some associations with dairy products that have been found. So just monitor how much cheese, milk, butter, those kind of animal products that you're taking within your diet. And then the other thing that would be very important is to realize what your personal risk factors are. Again, you mentioned an uncle. If you have a mom that has what's called BRCA, which is a type of gene for breast cancer. There's a BRCA1 and a BRCA2. That has been shown to have a certain higher incidence in males of developing cancers, and especially prostate cancer. And then after that, the number one thing is to just make sure, once you know your risk, you start early screening so that you can identify and have the further discussions. Now, you start your screening, what are you looking for? It's a simple blood test. And the blood test is broken down basically like this. If you're less than 2.5 to 3, that's the number. It stands for nanograms per milliliter. That unit is not important, but if you're less than 3, then you should be tested probably once every 2-3 years if you're low risk. If your number is between 4 and 10, then you're borderline. You should start being tested more regular and start having those conversations to say, hey, maybe I should go to the next step. Should I get an MRI? Make sure I'm getting the digital rectal exams. And your doctor may even suggest a biopsy depending on certain things.
Right.
And if you're greater than 10, so that number being 10, then you should most definitely go to the next stage and obtain a biopsy of the prostate to see if there are cancerous cells within there. A number greater than 10 does not guarantee you have cancer. It just makes you 50% at a higher risk. And between 4 and 10, you're at 25% at a higher risk. And that's the importance of knowing those numbers. Any questions on that? Because that's important to know.
Not necessarily. We're gonna open the phone line.
Okay.
It is 407-676-9023. If you're just joining us, we are talking with Dr. Christopher Scott, and this is Caribbean Diaspora Vibes. And this evening, our topic is about prostate cancer. This month, is Prostate Cancer Awareness Month. And of course, we also want to invite you. If you don't want to call, you can text. You can text 407-676-9023. And I don't know, I think Donna have a way to maybe have somebody from who's watching to maybe call or to text something as well. So those are some options that you have available. You are in tune to Caribbean Rhythms Radio Network. It is 6:29. This is Caribbean Diaspora Vibes. And of course, we're here talking to Dr. Christopher Scott about prostate cancer. My brother, again, eating, I heard all sorts of things. As a Jamaican, I hear all sorts of things. I hear that eating too much pork, is a problem with our men in the Caribbean and in the US diaspora, because a lot of us, we love the pork, we love the jerk pork, we love all sorts of pork here in the US. Is there any truth to all that pork eating stuff that cause prostate cancer?
No.
Let's talk about eating in general. How does that?
Right. So yeah, let's expand that. So
yes.
I would say the opportunity, I won't call it a problem as a pork eater. Right? So the opportunity around pork is that it has a lot of saturated fats. So does beef to a certain extent. So does a lot of other things like lobster and shrimp. A lot of these things have saturated fats. The more you move away towards things like poultry, they have less saturated fats. And then, of course, if you get into the things that these animals eat, so whatever pork eats gets absorbed within the saturated fat. And so you are in turn eating that. So it's not so much the pig itself, it's the pig and the muscle of the pig, you know, and any fatty animal that you are going to eat. The saturated fats are carcinogens within our diet. That being said, if you look at what plagues us in many of our neighborhoods, many of our fast food stores, many of the stores that target us are geared towards saturated fat. We cook our food in saturated fats, peanut oils, and all these things. We're not cooking in the olive oils or the more, you know, lesser saturated, unsaturated fats. So I would say if you can stay away from anything, broaden it from just pork to anything that contains a high amount of saturated fats and oils and grease and these things.
And good luck for the men them to stay away from that, right? Some of
So,
but this is where the women can come in now in terms of helping with the diet.
That's correct.
Helping to
it's not just the prostate, it's your high blood pressure, your cholesterol, your risk of stroke, all right, and your risk of all the obesity and all the other things that will channel down the line. Prostate is just one of the things that will follow.
And of course, we, as you said, we can't get away from the gene. If it's in our genes, that is a definite thing that some of us will get the disease at some point in our life.
Absolutely, you know.
We can't hide from the wonder. We can't
hide from it.
Yeah, we cannot eat ourselves away from it, regardless of what we eat. That is what it is. We just controlling. Let's talk about how somebody have it, you know, and some of the things that we need to do as men to make sure that we can live with it for a period of time. Let's talk about that.
Absolutely. So let's say you've gone through all the steps and you find out I have prostate cancer. So the first thing to realize, it is not an automatic death sentence.
Okay.
It is actually one of the most slow growing cancers that are out there. So you have men that live long lives and actually die from several other things other than prostate cancer. The importance is to know you have it and to monitor its growth and find out where exactly it is, because knowing where it is, meaning is it localized, is it regionalized, has it gone distant, will help you and your physician discuss some of the treatment options. And what are they? You know, one of the most dramatic, of course, is surgery. So the prostate can be removed in its entirety if everything is localized, and you know that is an option. It comes with the side effects of surgery itself. We talked about nerves that go through there, so of course everyone is concerned about their erectile dysfunction and these things, but surgery is an option, just like it is mastectomy or the removal of the breast to women. Other treatment options are radiation. So you can have radiation to the area to try and slow the growth, kill the cells that are there, and again, monitoring. Other treatment options involve chemotherapy, so the taking of drugs that specifically attack cancer growing cells. So that is another option. Of course, all these things come with their own specific side effects. And lastly, what a lot of people are actually moving towards is just surveillance. Remember, we had the discussion, if it's localized, if it's regionalized, and especially as we get the word out and the education and people catch it earlier in life.
Yes.
40, 45, we catch it earlier, then it's just a monitoring to see how fast, if at all, is it spreading. It's a very slow growing cancer. And if you don't have any symptoms, you went at 42 and found out my PSA is high, it's 12, and oh, I have it, but I don't feel anything. your physician might opt to say, let's just keep an eye on this, check your PSA regularly to see how often it's changing or increasing, do your rectal exams, and just keep an eye on the situation. So again, not knowing is much worse than knowing and seeking the appropriate medical advice.
Mm. So you can be diagnosed with prostate issues or cancer then.
Cancer and live a perfectly
And
normal.
Okay, got you. And that's including your sex life as well.
Absolutely. You may have no symptoms or idea that you even had it.
Mm.
That's why it's important to get screening. It's not something that you feel. It's not like a woman who feels a lump.
Yes.
You know, it's nothing like that. You may be totally asymptomatic.
Hmm. Very good to know. We hope that all our male counterpart and listeners out there, that you're getting some education this evening about what we're talking about. Very, very serious issue. In regards to you know, having this knowledge that we're getting this evening, what would you recommend? What you recommend someone should do right now at this point, whether you're 45 or 70? What is it?
The first thing everyone should do is contact your physician and obtain a prostatic screening antigen test, a blood test. Every male over 45, in my opinion, should know what their baseline is, meaning what is your first level. Majority of us will be 3 or less, and at least we know where we're starting from. And then every 3 years, if you are 3 or less, have it rechecked, because the year you go back and from 3, now you're 6, you will be able to know, wow, something has dramatically changed in the last 2 or 3 years. Whereas if you wait until you're 70, not that you shouldn't find out your numbers, but let's say you're 70 and your number comes back 8, you have no idea when it started to increase. Yes. And there are some things that increase the number that have nothing to do with cancer. So let's talk about that. Just the general fact of growing older will increase your PSA. Not to mention, a lot of us will get a thing called benign prostatic hypertrophy. So it's just that the prostate grows larger, but it's not a cancerous thing at all.
Yes.
That can make your levels higher as well. But you won't know the difference unless you go and obtain the test. Certain other things, such as you just ejaculate. So any stress or trauma to the prostate will release this chemical into the blood and it will raise it up. So if you're riding a bicycle and you jump off the bicycle and run into your doctor's office to get the test, it can falsely elevate your level. Just have sex and your prostate rub up against whoever, it can squeeze it and elevate the thing. And in the same way, if you ejaculate, you know, that squeezing sensation to ejaculate the semen can raise up the level of the prostate. So that's why it's best to understand these things, get a baseline so you know where you are, so you can track it. That would be my #1 advice to anybody listening now, starting from age 45.
45. So if I go call my doctor tomorrow, doc, what am I asking for? Am I asking for a screening for prostate cancer or baseline? Give me some exact quote here or a little script.
No, not a problem at all. Doctor, I am a Black male in this hemisphere, and I would like to know my baseline PSA. Simple as that.
Baseline PSA. And you are saying that the norm should be around 3.
3 or less.
3 or less. If it's above 3 or less, then something needs to start.
Some questions need to be asked.
Got you.
And if it's above 10, some serious things need to be looked into.
Yeah, you need to get yourself scrubbed. If it's above 10, that's a serious situation there.
That's correct.
Very good. So we're going to ask men out there, you're going to start call. Do not wait. If you're 45, if you don't know anything that you have prostate cancer, listen, call the doctor tomorrow morning. Not tomorrow, Monday morning. Most of them closed and doing the Sunday thing like us. Call them Monday morning. You need a baseline PSA. I will be doing that first thing Monday and going to see my doctor to see what that is. Because one of the things that I am delighted to say, doctor, I started, when I go to my doctor now and I do my labs, I request my lab every 6 months or so. And I said, doctor, I want to see my results. And we started it about 3 years ago. And it's one of the best things that I have ever done. He discussed every line, every numbers to me, what these numbers mean, where your numbers need to be. And it's one of the best things. It allows me to eat much better because my numbers, everything in your body have a number. It equates to a number that you're supposed to be. That is your line, your baseline, or whatever the case might be. So very important that I didn't know about this number, this baseline number. I will be definitely looking for that and asking questions about any issues that there is above the tree, if there's a number there.
You know, you made a very good point, and this is probably one of the main reasons why I make sure I do shows like this. I want everyone to realize first and foremost, your doctor is not God. They are a human being just like you. I tell everyone, medicine is what I do. It is not who I am. And so you must be empowered as an individual to ask and question your physician, medical provider, same way you would ask and question the man who have met curry goat round the back. You want to know if a man clean. You want to know if your banker look out for your money, or anybody that's doing you a service. You need to make sure you ask them a question. So as you said, if you don't understand what any number means when you get lab work, or any physician tells you, look, this is what I really suggest you do. A simple 3-letter word, why? If they cannot tell you why, then I suggest you question the relationship between you and your medical provider, because hopefully I've told you why you need to do these things, why you need to get tested. Why it affects us more is still research, genetics, things like that, but it does. The same way I advocate COVID vaccine, the same way I advocate regular testing for blood pressure and sugar, is because it affects us disproportionately. It has beneficial results, and medicine is something I study. You can question me and I should be able to give you some response in return. And if I don't know, I'll be the first to tell you, I don't know, but I will look it up and get back to you. It's a simple thing like that, the relationship you should have with your medical provider.
Yeah, very, very good point, doctor. It is us who don't take the time, and I realize that it is us who don't take the time. We go to the doctor, especially us men. Women, you all they ask all type of questions. So I ain't going.
Weirdo.
They just ask everything. If there's a lump, there's a bump, they ask everything. So that's good on the women's side. We men, as soon as we go into the doctor office and the doctor see us, we're gone through the door.
That's
no
right.
questions asked. We don't want a relationship with no doctor. It is totally wrong. I must say that that is totally not the way for us to operate. We must start educate ourselves about ourselves. I'm going to quote Marcus Garvey. We must educate ourselves to the knowledge of our soul.
That's correct.
And that's meaning knowing exactly who we are, our skin, what behind the skin, what are the things that makes us up. I'm going to get biblical. God made us to live 120. My uncle Moses, he walked to his grave as 120. His eyes was bright and strong. That's what the Bible says. His health was he was in great health. The man goes to walk and sit down and close his eyes.
And you look for the bronze,
yes,
the woolly hair.
Yes, sir. Are we that? That is 100% us. So we must take it our responsibility. If we help ourselves, God will take care of the rest. But we have to ask questions. We have to understand our body. We have to have the interest to say, I want to live, and not just live, but live a healthier life.
That is correct.
Beyond our ancestors, because they did a lot of things that we don't want to do. We have more knowledge today. We can get more knowledge right at our fingertip. I can take up the cell phone and look up any history or any books that you wrote, doctor. I can see them, I can read them and find your knowledge into what my life's supposed to be. So I want to encourage all my brothers out there that are listening. Not only that, when you get the opportunity, if you have a son in your house, take the son with you from early. Let him understand that these are the things that he needs to do, because we're not talking to our sons now, boss, doctor. We're not doing that enough so that the son can be educated right beside us when the doctor said, hey, your sugar level is 150 and you need to be a 100. Okay, doctor, how do I level these things? Or my baseline is 7 and it's supposed to be beyond 3. How do I keep this thing down? The thing that most of us are afraid of, which is having somebody check us. I guess we have to go to the rectal, our
the DRE, the dreaded DRE, digital rectal exam.
How do we get over that?
It's a cultural thing. It's something that we have to understand, just like a woman on a pelvic exam. It's nothing sexual. It doesn't have anything to do with heterosexual, homosexual. It is an exam. It's an exam of an organ within your body that
you need to know about.
Yeah, you need to know about it.
Yes.
It's as simple as that. And if you have blood in your stool, if you have, polyps, most of us just know what happened to the actor, right? The black actor that died from the colon cancer. It's something we need to keep an eye on.
And how often, because I give thanks to my wife. If she's listening, I thank you so much, honey, for really encouraging me and push me. Well, Mr. She pushed me in a bar. She pushed me.
She wants you around. She wants you around.
Yes.
Push him, yes, push him.
Yes, she pushed me, man, and pushed me. And I eventually said, I don't want to do it with a male doctor. Give me a female doctor. Which that was a little bit easier on my mindset. Okay, so
hear the joke about that now.
Yeah.
Woman not have prostate, so where you look for a woman that she know what she look for with experience, but she not have no prostate. Take away the sexual connotation. Yes. You just want a good doctor, male or female.
Bottom line.
Because my finger not bigger than any third will come out. They're all of them smaller than any caliber stool. So
it's education. It's education we need in not only even on the pulpit. The preachers must educate our men to go and get these things, because our men are dying, leaving our women too early.
That is correct. Studies have shown a majority of word of mouth education within the Black community actually comes to our churches.
Yes.
Churches as a large venue of a vehicle, I should say, of education and dissemination. You hear all the time when it's voting time, people start political banter right from the pulpit. So, definitely it's something I believe most of our preachers, pastors, whoever goes synagogue, roots man, whoever you listen to, make sure that they're taking your health into benefit as well.
Yes, that is so true. My last question for you is, okay, so you get it done, right? You do your prostate examination. How how often do you recommend that it's done for a man?
So if you are negative on the PSA and you stop there, you can go every 2 to 3 years and get it rechecked. If you are borderline on the PSA, they might start recommending yearly. So every year you go check it to monitor it, and you make sure you get a digital rectal exam. All right. Now, if you're high, or you have been found to have a relative that has found one really early, they may suggest every 6 months, because they really want to keep a close eye to see how things are changing. All right. So just think 2 to 3, 1 are in a really tenuous, dangerous situation. Maybe even 6 months, they want you to come back twice a year. It's a blood test.
Very, 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 very important subject this evening, everybody. We hope that you will, take the opportunity and follow the doctor advice. This evening, we have Dr. Christopher Scott with us, who is our special guest talking about prostate cancer. And we want to see our men live. We want to stay long. God make us to enjoy 120 as long as we possibly can. He didn't make us to die. That's the bottom line. We are the one who do not follow the things that we're supposed to do and get ourselves checked the right way. So we encourage everybody this evening to find a way to do that. Doctor, I have done it once, and boy, it passed the time, long time now, you know.
Boy, that's what you thought. You promised say you're gonna call Monday.
No. I'm on it. And I know my wife listening, she will probably call before I do.
Yeah.
So,
and you have many different venues, you know. You have many service groups. I was at an event July, and we were offering free prostate screening to those in Eatonville. It was a Shriners organization. We were right there in Eatonville, and it was free prostate screening opening to the public. And we could caught several people who were surprised that their levels were elevated.
wow.
So that was my last screening. It was in July.
It's important for us to, when we see, a lot of us, when we see these free screening thing, we don't show up, or whatever the case might be.
Take advantage. Take advantage. I'm sympathetic to the fact that, you know, not everybody have medical insurance. No?
Yes.
Everybody can afford a co-payment. You know, the economy have certain influences. But if you see a diabetes screening, if you see a colon screening, the fairgrounds have it. Like I said, we have things in Eatonville. You have various organizations. Like everybody have cell phone. No, we can't afford things, but a lot of people have cell phone. Just Google it. If you not have one, you know somebody that have it. Ask them to Google a screening, and you can go and get yourself checked.
That is awesome. It is 6:53. I'm going to ask you, doctor, to sort of sum it up for me now. Give us a summary of what we have just said, you have just said, for the people before we get out of here this evening.
Yeah, so first and foremost, if you're a male of color on this side of the hemisphere, this side of the world, you're at high risk. You have the highest risk of any nationality, race, creed, or color of developing prostate cancer. At age 45, 40, if you have a relative that already has it, please make sure you, as soon as possible, obtain a PSA, or prostate specific antigen test. It can be obtained from your medical doctor, or as we said, sometimes there's organizations that do free screenings. From there, you will obtain a number, and they will give you guidance on what that number means. The prostate is an organ that sits right under your urine bladder. So if you find yourself waking up frequently, or if you're next to your spouse, mate, and they find you're waking up frequently to go to the bathroom, and when you go to the bathroom to urinate, you just see a little stream, weak stream, dribbles, or blood, or you find when you ejaculate, you have pain, sooner than later, you need to make sure it's not prostate cancer. And also, same way, if you're a male and you find that, hey, I feel a lot of pressure down there when I'm trying to go to the bathroom, you need to go and check and make sure it's not prostate cancer. So hopefully that gives it a good sum. Again, if you have it, it's not an automatic death sentence. It's one of the slowest growing cancers that is out there. But if you don't know, you can't move on to make sure that it's taken care of.
Because this hearing that you maybe have prostate cancer, don't check it out. That alone will kill you.
That alone will kill you. Yeah, I frighten away most people.
You frighten and fret and just kill yourself without dealing with the issue.
Correct. 99% survival for most people.
Yes. Donna, are you still with us? Any wrap-up word from you, if you're still with us?
Yes, very valuable information, guys. I'm so thankful to Dr. Scott to be able to come and share with us and share to the community. Definitely giving thanks for the information. So for the male, if they're 30, that's not really the age to start checking. So 45 is a better age.
So below 40, unless you've had if you've had a relative that has prostate cancer, a father, uncle, brother, your chances are significantly diminished once you're below 40. So the recommended age, which is actually mimics colon cancer as well. So at 40, you need to really start asking yourself some questions. Do I have a relative that has colon cancer or prostate cancer? If the answer is no, then make it a mid-40 birthday kind of celebration to find a physician and be screened for prostate cancer, PSA blood test, as well as colon cancer, which would involve a stool sample. We won't get into that right now, but get your first real checkup, screening checkup, 45 guaranteed, hands down.
Awesome.
Okay. And there wasn't really any preventative.
No, again, we talked about watching the diet, keeping your eye on your dietary intake, which has a lot of other consequences as well. Dietary products increase cholesterol. We talked about the avoidance of saturated fats in the diet. So, keep your eye on your fried foods, your heavily saturated meats. And, the only other risk for which I can't offer a prevention is where you live and the race that you are born into. So once you realize that, you already know you need to go and get checked.
Wonderful information. Thank you so much, Dr. Scott. We really appreciate you. Loving the beard game, boy.
Man, look distinguished, man. This
I got them call it no. We move away from saying me look old. So
yeah,
accept it no, the distinguished.
Yes, sir. I love it. Thank you again.
All right.
God bless you, my brother.
Peace and love to everyone. Again, you know to reach me if you need anything, and of course, reach your direct physician. I can be found at many of the HCA emergency rooms around the area. We have them at Lake Nona. You have them at Osceola Regional, Point Siena, Central Florida Regional. You can go in and ask anyone what you heard, but always check your primary care physician first. That's your best point of contact.
Awesome.
All right.
Sounds good.
All right, everyone. You've been listening to Caribbean Diaspora Vibes. We appreciate you. Again, this is recorded, so you can go back and bring your loved one to listen to this valuable information. Thank you, everyone. Thank you, Dr. Scott. Thank you, Louis.
Awesome.
Dr. Bavon, Debrio, wherever you are. Blessings, everyone. And until next time, be blessed.
Peace and love.
Very good. Thank you. God bless and keep as we continue right here. As we continue, we have come to the end of this segment for today, Saturday, the 24th of September, 2022. God bless you. We'll catch you next week at the same time. I think we're off next week, Donna. Am I correct? All right. We're off from Caribbean Diaspora next week, but we'll catch up with you again. God bless you. Keep it right here.